A 14-year-old from Wilmington won the state's first $125,000 scholarship just for getting the COVID vaccine. Every 12 to 17-year-old is entered if they get the vaccine, but experts say a whole lot of teens still have not gotten it. In today's To Your Wellbeing, we're talking about kids and the COVID-19 vaccine. Cone Health Executive Medical Director of Pediatric Services, Dr. Michael Cinoman, will be answering all those questions for the next 30 minutes. So let's start with this. When should kids ages 12 and up get the vaccine? Do you want it now or closer to school time?
We recommend that everyone get vaccinated as soon as they possibly can. The sooner they're vaccinated, the sooner they are protected, the sooner they can go back to life as normal, and our pandemic goes into the rearview mirror.
A lot of parents, though, wonder, do you need to space them out with the kids' other vaccines for back to school? Are they okay to do them all at once?
It is absolutely okay to do it all at once. That was a question that I think everyone had at the beginning, and we weren't sure. Right now, recommendations are that you should absolutely be able to get all the vaccines that you want at the same time, including the COVID vaccine. There should be no ill or additional effects from that.
You were talking about at the beginning we weren't sure, but now we have more evidence. It seems like we've learned a lot about the vaccine in kids since we started giving it out.
We have. I think there's a lot of experience in a lot of people. 177 million Americans, just people in the United States, have already been vaccinated with COVID, and many more have even received one of the two doses. So we've developed a lot more experience in terms of the side effects and the profile of the vaccine, and indeed its efficacy.
So is this something that parents can just take their kids to the pediatrician's office? Do they have to make some special appointment?
Currently, you still sort of have to make a special appointment. The vaccine is a little bit more complicated to handle than most of the other pediatric vaccines. So Cone Health has tried to make it as easy as possible for anyone going to their pediatrician or family medicine doctor. You just call our number. You can either go to the website, conehealth.com vaccines, or the phone number. The easiest way to make the appointment is to call 336-890-1188 and schedule an appointment. And your vaccine for your 12 to 17-year-old will be scheduled in one of our 4 pediatric practices, where people obviously familiar with children and giving shots to teens and adolescents are very experienced. They can still get it at the Coliseum and some of our other larger sites that will be still continuing to vaccinate. But as of the last couple of weeks, we have added this to our pediatric practices as well.
I imagine there's plenty of suckers and prizes around there to give the kids when they get the shot.
There are some, yes. Stickers are always a big one, but the adolescents are a little bit choosier.
Well, hey, there's been so many stories in the news about this possible link to heart inflammation. A lot of parents are really worried about that, especially in younger people. What do we know about that?
Great question. There does appear to be association for developing heart inflammation after receiving the second dose of the COVID vaccine. It's not just in adolescents. It occurs in people of all ages, but it does appear to be more common in the younger populations. But the important messages and the important facts are that it is still extraordinarily rare. Of all those 150 to 70 million vaccines that we've given, there have been 300 some odd cases of documented heart inflammation after the vaccine. That's an incredibly small percentage. And there is other good news. Heart inflammation obviously can make people very uncomfortable, and it sounds like it is life-threatening. And in some cases, viral infections of the heart are very serious. This appears to be very self-limiting. Everybody who has gotten this has recovered. Some have been hospitalized but have gone home. And as far as we know, every single person who's experienced this has fully recovered from getting it. I think the other major point that is important to make when you talk about heart inflammation in the vaccine is that the infection itself can cause heart inflammation. Again, it's relatively rare.